Question number 1. Which findings are typical of end-stage renal disease? Select all that apply. A, iron deficiency anemia. C, decreased creatinine clearance. And D, metabolic acidosis. Question number 2. The nurse is providing care for a 2-month-old infant scheduled for a pyloromyotomy. Which of the following preoperative actions can the nurse expect to perform? Select all that apply. D, keep NPO as ordered before surgery. E, begin IV fluids to maintain its rate. F, place NG tube to low suction. NG tube means nasogastric. Number 3, a patient who is receiving treatment for varicella asks for assistance to the bathroom. Before entering the room, you must don personal protective equipment. Organize the correct sequence in how you will don personal protective equipment. Its sequence: drag and drop, arrastra y suelta. A, don gloves. B, don gown. C, perform hand hygiene. And D, don N95 mask respirator. Question number 4. Select the 4 findings that require immediate follow-up case studies. The number 4, it's a case study. Answer, vital signs. Answer, lung sounds. Answer, radial pulse characteristics. And answer, characteristics of the cough. Cough means toser. Question number 4. Click to highlight below the 3 orders that the nurse should perform right away. It's a case study. Answer, insert an indwelling urinary catheter. Answer, 0.9% sodium chloride or normal saline, 500 milliliters IV once. Answer, a laboratory test, blood culture and sensitivity, CNS, and complete blood count, CBC, and arterial blood gas, ABG. Question number 6. Drag the correct response into the right column into the correct order. The nurse manager is conducting an educational session for the nurse on non-selective beta-adrenergic blockers or beta blockers. How should the nurse manager accurately describe the mechanisms of actions of these medications? List the options in order from first to last. All options must be used. Number 1, heart rate and blood pressure are decreased. Number 2, epinephrine and norepinephrine actions are blocked. Number 3, beta-1 and beta-2 receptor sites are blocked. Number 4, cardiac workload and oxygen demands decreases. And number 5, sympathetic nervous system's effects are decreased. Question number 7. The nurses review the nurse's notes from 1,300, 1,500, 2,000, and 2020. Based on the information, which is the priority actions by the nurse? Answer number 1. Ensure that endotracheal intubation is ready at the bedside. Question number 8. The nurse provides education during the discharge of a client who has a diagnosis of multiple sclerosis. Which priority statements does the nurse include in the teaching? Answer, it's number 1. Schedule the occupational therapist to do a safety assessment of your home. Question number 9. Click to highlight the findings that are recognized as needed only standard precautions. Monday, 1000. The client report pain level 9/10 at upper abdominal. 9/10 at upper abdominal is going to be highlighted. Discomfort for the last week. He reports watery diarrhea for the past 3 days for 8 times a day. Assessments includes long sounds without adventitious sounds. Highlighted, long sounds without adventitious sounds. Heart rhythm regular with S1 and S2, capillary refill at +2 seconds equal whips, alert and orientate by 4. Visible jaundice. Visible jaundice is highlighted. Client reports HIV positive for 3 years. White blood cells counts round with results of 1,000. The reference range 4,500 to 11,000 white blood cells per microliter. Question number 10. Complete the following sentence by choosing from the list of options. The nurse will use contact. Answer is standard. Precautions when provide care to the clients because. Answer is not contagious. So in question number 10, the answer is going to be the first one, standard, and the second answer is going to be is not contagious.